Leopold manure. Leopold manure. Leopold's manure, named after a German obstetrician and gynecologist Christian Gerhard Leopold, are the parts of physical examination of pregnant women. Why is it performed? The aim of Leopold manure is to determine the fetal presentation and position by systematically palpating the gravid abdomen, as well as estimate your baby's weight. This process allows medical professional to not only make a birth this process allow medical professional to not only make a birth weight estimate but also address any underlying problem that may occur down the road. This will help you and providers be better prepared for your labor and determine if it might be safer to perform. They are also low cost, non-invasive, and don't require a use of expensive equipment such as an ultrasound. Plus, they tell your provider how ready your baby is for the birth so they can better prepare for your labor. Leopold's preferably performed after 24 weeks of gestation. Factor affecting difficult to perform in obese women, women with hydromnios, women with full bladder. What are the four manures? First manure is fundal grip, second manure lateral grip, third manure second pelvic grip or Pauli grip, fourth manure Leopold's first pelvic grip. Nursing considerations: instruct the woman to empty her bladder, wash hand, provide privacy, verify the client, explain procedure, place woman in a dorsal recumbent position, warm hands by rubbing together, use palm for palpation, not the finger. First maneuver, fundal grip. While facing the woman, palpate the upper part of abdomen with both hands. Often determine the size, consistency, shape, mobility of the form that is felt. The fetal head is hard, firm, round, and move independently of the trunk, while buttocks feel softer. It's symmetric and has small bony prominence. It moves with the trunk. Second maneuver, lateral grip. Facing of the woman, the healthcare provider palpate each side of the abdomen with gentle but deep pressure using the tip of his or her hands. The fetal back is firm and smooth, hard, resistant surface. Fetal extremities feel like small irregularities and protrusions. Third maneuver, Pauli grip. To determine what fetal parts is lying above the inlet or lower abdomen. The individual perform the maneuver first grasp the lower portion of the abdomen just above the pubic symphysis between the thumb and finger of the right hand. Fourth maneuver, pelvic grip. The healthcare provider faces the woman's feet as or she will attempt to locate the fetus brow. To determine the degree of flexion of the fetal head, the finger of both hands are moved gently down the side of the uterus towards the pubis. Attitude. Describe the position of the parts of your baby. The normal fetal attitude is commonly called as the fetal position. The head is tucked down to the chest. Arms and legs are drawn in together to the center of the chest. What is good attitude? If the brow corresponds to the side that contains the elbow and knees. What is poor attitude? If examining finger will meet obstruction on the same side as the fetal back. Let's see what is the ideal position for the fetus. At the beginning of your pregnancy, your baby will move around your womb freely, but towards the end, they should get into the certain position. Before birth, your baby should be head down, facing your back with its chin tucked into its chest so that its head is ready to enter the pelvis. This is called cephalic presentation and it is ideal position for delivery. Most baby will settle in this position between the 32 and 36 week of your pregnancy. This This position make labor less complication. Around 96% of baby will born in the cephalic presentation, abnormal position or presentation, cephalic posterior position. This position, also known as an occiput position, or it's sometimes nicknamed sunny side. It means that your baby is positioned head down, but they are facing out instead of towards your spine. This position could increase your chances of an painful and prolonged labor. Bridge position. A bridge position means that your baby's bottom is facing downward. There are three different bridge positions. Rank bridge. The baby's legs are up with feet near the head. Footling bridge. One of the both legs are lowered in the cervix. The complete bridge. The baby's bottom is first and its knee are bent. Any of these positions can make for and riskier delivery, so you are a risk of cesarean section delivery if baby doesn't change position before labor. A transverse lie. Your baby might also be in a transverse lie position at the end of third trimester, which means they are lying sideways across your uterus instead of vertically. If they don't change position, it could make for dangerous labor. So as a C-section will be required. Other presentation are face presentation and brow presentation. In face presentation, the neck arc back so that the face presentation first. In brow presentation, the neck is moderately arched so that brow present first.